Wednesday, September 13th, 2023, AGNDD Intellireport topic. African trypanosomiasis. Please pardon any visual and informational inaccuracies in this entirely AI-generated Wikipedia-sourced video article.
African trypanosomiasis, or sleeping sickness, has two stages: hemolymphatic and neurological. Neurological symptoms occur when the parasite invades the central nervous system. African trypanosomiasis, also known as sleeping sickness, has two stages: hemolymphatic and neurological. Neurological symptoms occur when the parasite invades the central nervous system. It can be difficult to distinguish between the stages based on clinical features alone. In individuals from non-endemic areas, the disease may present with atypical symptoms such as fever and gastrointestinal issues instead of the typical symptoms. The reasons for this are unclear and may be genetic, but the low number of such cases may have affected the findings. Systemic disease can be indicated by the development of a trypanosomal ulcer at the site of a fly bite within 2 days of infection. This ulcer is more commonly seen in TB rhodesiense infection and rarely in TB gambiense infection. However, in TB gambiense infection, ulcers are more common in individuals from non-endemic areas. The incubation period for TB rhodesiense is 1 to 3 weeks, while it is longer and less precisely characterized for TB gambiense. The initial stage, known as the hemolymphatic phase, is characterized by general symptoms such as fever, severe headaches, joint pains, itching, weakness, malaise, fatigue, weight loss, swollen lymph nodes, and enlarged liver and spleen. Diagnosis may be delayed due to the nonspecific nature of these symptoms, and the disease may be mistaken for malaria. The fever experienced in this condition is not constant, but occurs in episodes that can last from a day to a week. These episodes are separated by intervals of a few days to a month or even longer. As the disease progresses, the frequency of these fever episodes tends to decrease. The invasion of the circulatory and lymphatic systems by the parasite causes significant swelling of lymph nodes, particularly in the posterior cervical region. Other lymph nodes in the axillary, inguinal, and epitrochlear areas may also be affected. Winterbottom sign, characterized by swollen lymph nodes along the back of the neck, is a common indicator of TB gambiense infection. In addition to the main symptoms, individuals affected by this condition may also experience a skin rash, hemolytic anemia, enlarged liver, abnormal liver function, enlarged spleen, hormonal imbalances, heart problems such as pericarditis and congestive heart failure, and eye-related issues. The second phase of the disease, known as the neurological phase, occurs when the parasite enters the central nervous system. This phase can occur after 21 to 60 days for TB rhodesiense infection and 300 to 500 days for TB gambiense infection. The two phases of the disease overlap and are challenging to differentiate based on symptoms alone. The stage of the disease is determined by examining the cerebrospinal fluid for the presence of the parasite. Sleep-wake disturbances are a prominent symptom of African sleeping sickness, also known as neurological stage. Infected individuals have disrupted sleep patterns, with daytime sleepiness and nighttime insomnia. They may also experience sudden episodes of sleepiness. Neurological symptoms can include tremors, muscle weakness, paralysis, abnormal muscle tone, difficulty walking, speech problems, numbness or tingling, vision problems, abnormal reflexes, seizures, and coma. Parkinson-like movements can also occur due to nonspecific movement disorders and speech disorders. Psychiatric symptoms can be a significant factor in clinical diagnoses, with individuals experiencing symptoms such as aggression, apathy, irritability, psychosis, hallucinations, anxiety, mood swings, confusion, mania, attention problems, and delirium. These symptoms can have a significant impact on an individual's mental health and overall well-being. Without treatment, the disease caused by Trypanosoma brucei parasites is fatal. The disease leads to mental deterioration, coma, organ failure, and ultimately death. If left untreated, an infection with TB rhodesiense will cause death within months, while an infection with TB gambiense will cause death after several years. The neurological damage caused during the disease's progression is irreversible. Trypanosoma brucei gambiense is the main cause of African trypanosomiasis, with humans as the primary reservoir for transmission. Trypanosoma brucei rhodesiense, on the other hand, is mainly transmitted through animals but can accidentally infect humans. The spread of the disease depends on the interactions between the parasite, the tsetse fly vector, and the host. There are two subspecies of the parasite responsible for causing the disease in humans: Trypanosoma brucei gambiense in West and Central Africa, and Trypanosoma brucei rhodesiense in East and Southern Africa. A third subspecies, Trypanosoma brucei, affects animals but not humans. TB gambiense causes a chronic condition with a long incubation period, while TB rhodesiense is an acute form with a faster progression. The parasites have a coat of variant surface glycoproteins, VSG, that protect them from the host's immune system. But the immune system can produce antibodies to fight the parasites. However, the parasites can change their VSGs, evading the immune response and causing infection. The tsetse fly is a large, brown, biting fly that serves as a host and vector for trypanosome parasites. When it bites a mammalian host, it injects infected parasites into the skin tissue. The parasites then enter the lymphatic system and bloodstream, where they transform and replicate. The entire life cycle of the trypanosomes occurs outside of cells. The disease can also be transmitted through mother-to-child infection, laboratories, blood transfusion, and possibly through other fly species. Tryptophan is a compound created by the trypanosomal parasite responsible for sleeping sickness. It has the ability to induce sleep in humans. The gold standard for diagnosing trypanosomiasis is identifying trypanosomes in a sample through microscopic examination. Samples such as ulcer fluid, lymph node aspirates, blood, bone marrow, and cerebrospinal fluid can be used for diagnosis. Detection of trypanosome-specific antibodies can also be used, but its accuracy varies. Wet preparations or stained smears can be examined under a microscope to detect trypanosomes. Concentration techniques can be used to increase the chances of finding the parasite. Serological tests like microcat, WBcat, and WB latex are also available for detection. African trypanosomiasis, also known as sleeping sickness, is a disease transmitted by tsetse flies. Currently, there is no vaccine for immunity, so prevention methods such as using insect repellents, wearing protective clothing, and avoiding tsetse-dense areas are recommended. Efforts are being made to eradicate the tsetse vector population through campaigns using insecticide-impregnated targets, fly traps, and insecticide-treated cattle. Systematic screening and prompt treatment of new infections are crucial for controlling the disease. A pilot program in Senegal has successfully reduced the tsetse fly population by introducing sterilized male flies. For first-stage disease caused by Trypanosoma brucei gambiense, the recommended treatment options are fexinidazole taken orally or pentamidine administered through injection. On the other hand, for Trypanosoma brucei rhodesiense, suramin is the preferred treatment given via injection. Fexinidazole is a potential treatment for the second stage of TBG, but it is more effective and has fewer side effects when combined with nifurtimox and eflornithine or used alone. These treatments may replace melarsoprol, which was previously the standard treatment but has a higher risk of death and can develop resistance. An ET requires fewer eflornithine injections and is the only treatment for second-stage TB rhodesiense. If left untreated, TB gambiense and TB rhodesiense, two forms of African trypanosomiasis, can be fatal. TB gambiense progresses slowly, with infected individuals showing no symptoms for months or even years until it reaches an advanced stage that is difficult to treat. TB rhodesiense, on the other hand, progresses rapidly, and symptoms appear within weeks or months of infection. It invades the central nervous system and leads to death quickly. Sleeping sickness, also referred to as human African trypanosomiasis, HAT, has resulted in approximately 9,000 deaths in the year 2010, a decrease from 34,000 in 1990. The estimated number of disability-adjusted life years lost due to this disease is 2.0 million. In 2014, there were 3,797 reported cases of HAT, which signifies an 86% reduction compared to the year 2000. Sub-Saharan Africa is the primary region where this disease is prevalent, with the Democratic Republic of the Congo being the country most affected by it. The World Health Organization has set a target to eliminate sleeping sickness by the year 2030. Sleeping sickness, also known as African trypanosomiasis, has been present in Africa for thousands of years. It was initially limited to isolated pockets due to lack of travel between indigenous people. However, the disease spread when Arab slave traders entered Central Africa, bringing parasites along. The first effective treatment, atoxyl, was introduced in 1910, but had serious side effects. Other drugs such as suramine, trypanosomiasis, and pentamidine were later developed and used to treat different stages of the disease. Melarsoprol is effective for second-stage sleeping sickness. The genome of the parasite causing African sleeping sickness has been sequenced, leading to the identification of potential drug targets. The parasite's ability to evade the immune system has been attributed to its ability to mix and match proteins. Researchers are studying the use of a genetically modified bacterium to control the disease. Recent findings suggest that the parasite relies on its flagellum to survive in the bloodstream, providing a new target for treatment. Vaccines for the disease are also being researched. The compound fexinidazole has shown efficacy and safety in treating the disease and has been approved for use in certain regions. In 2012, the total global research and development funding for kinetoplastid infections, including human African trypanosomiasis, was approximately $136.3 million. African sleeping sickness, Chagas's disease, and leishmaniasis each received around one-third of the funding. Public sources, especially from high-income countries, were the main contributors, but their funding has been decreasing in recent years. Philanthropic foundations like the Bill and Melinda Gates Foundation have become more involved and provided substantial funding. Industry also contributed to research and development efforts through public-private partnerships. Both types of trypanosoma, rhodesiense and gambiense, can infect animals like cattle and wild animals. African trypanosomiasis has been primarily seen as a disease transmitted between humans, so control efforts focused on treating human cases and eliminating the vector. However, animal reservoirs may play a significant role in the endemic nature of the disease and its resurgence in certain areas of West and Central Africa. In conclusion, African trypanosomiasis, or sleeping sickness, has distinct stages and can present with atypical symptoms in individuals from non-endemic areas. The development of a trypanosomal ulcer can indicate systemic disease.
Thank you for watching this AGNDD Intellireport. Like, subscribe, and click the bell button to get notified during new uploads, and make sure to tune in next time. Stay safe and healthy. Cheers.